Today is March 1st. It marks the start of Colorectal Cancer Awareness Month.
Adults across the U.S. are being diagnosed at younger ages. In fact, 1 in 5 colon cancer cases are now being diagnosed in people in their early 50s or younger.
That's according to a new colorectal cancer report released today from the American Cancer Society. Earlier today, we talked with Arif Kamal, the Chief Patient Officer at the American Cancer Society. Doctor, are you surprised by this study?
Yeah, it's a pretty remarkable shift in where we had been seeing cancer progress going, not only in colorectal cancer, but just in general. It's going in the opposite direction of where we had seen before and where we wanted to go. And there's some pretty important sort of lifestyle and cancer screening implications to that we'll talk about.
Well, specifically, what are the statistics that this study revealed, and why is it causing so much alarm?
Yeah, well, generally speaking, we think that colorectal cancer incidence had been going down for decades at a time, particularly because of the benefits of colorectal cancer screening, right? People getting colonoscopies done and at-home screening done as well. And then kind of all of a sudden we saw that curve start to shift, particularly in younger folks under the age of 55, where we see a year-by-year trend of 2% more people getting diagnosed with colorectal cancer under the age of 55 every year for the past 10 years or so. And that's quite alarming and different than what we had expected.
Even detecting it in people as young as 30.
That's right. I've taken care of patients who are near that age, and for them, there's oftentimes an issue of family history and an increased risk. And so I think it's really important that patients understand whether they're at average risk, meaning that the guidelines starting at the age of 45 apply to them, or whether they're at an increased risk because of a really important and compelling family history that they should know and talk to their doctors about and potentially do something different than what the guidelines might say.
What is causing so much more colorectal cancer in younger people?
Yeah, well, I think it's important to remember that colorectal cancer screening is not just about finding something early, but actually getting it out of the system as well, right? What we're looking for when we do colorectal cancer screening is a pre-cancerous change, a polyp that we are intending to remove and take out before it turns into cancer. So when people don't get colorectal cancer screenings done, it's not surprising that the number of new colorectal cancer cases goes up. And we see that in people under the age of 50, where the cancer screening rate is 20% or 25% versus their parents, who might be 65 or 70, who are getting that at a 75% clip. And for their parents, the incidence rate is going down. And for those who are 45, the incidence rate is going up. And that's very clearly aligned with the cancer screening rate. So, sorry, I'll just say the second part of that is really around lifestyle change. What we recognize is a clear relationship between obesity, smoking, excessive alcohol use, and sedentary lifestyle. And it's also something important to note, meaning that as some of those changes, particularly obesity and overweight status, are a bit different in folks who are 40 today than, let's say, 20 years ago. That's an important trend for us to pay attention to and try to reverse.
Are there any symptoms or things that people should look out for that would trigger, say, maybe I should get this done?
Well, yes and no in terms of symptoms. First is the purpose of colorectal cancer screening is to find it before there are symptoms, because generally speaking, the problematic, troublesome, troublemaking cancers are the ones that cause symptoms. Generally, they're more advanced by the time they cause symptoms, and they're harder to cure and harder to treat at that point. So the idea is find it before you feel any different at all. But what I would also say is this: there's a trend in our research that shows some of the cancers moving to more the left side of the colon, which is more closer to the exit ramp, if you will, of the body. And that means that there's, for those left-sided tumors, an ability to show up with bleeding, changes in the stool, particularly a darkening of the stool to a black color, even abdominal pain. And I would highly recommend, if people are experiencing that they bring that to their doctor's attention.
And quickly, what is the recommendation for your first colonoscopy at what age?
45, no doubt about it. 45, and that's right. And any colon cancer screening, that includes colonoscopy, but also 2 different types of at-home colon cancer screening tests. And that's the conversation people should have with their doctors, which is, what is the right test for me?
Absolutely. Doctor, thanks for being with us. Interesting numbers.